Hello, good morning. Good morning, everyone. Good morning, kids. How are you doing? How are you doing? Have you,
Thumbs
yeah.
up. You can
Now,
show your thumbs
yeah.
up, children.
Are you good? I hope everyone is good. I hope everyone is free of corona and staying in the house and enjoying, right? Eating, having fun, playing, right? Right. Now we're gonna discuss something which is very, very common, right? And it is called common cold. Why it is called common cold? Because it's very common. Every human being on this earth will be affected by that cold. Okay, that's why it's called common cold. Right. Now, what are the definition for it? It is just a viral infection of the nose, throat, and sinuses. Right. And why it comes? Why it comes? What is the reason behind it? So it comes because of the some viruses. There are 200 odd viruses which causes common cold, and these are, and most of the times it is rhinovirus, parainfluenza virus, and sometimes it can be influenza virus. And do you know what are viruses? They are very, very small particles which go into your body, and they can cause the disease, right? Now, what are the symptoms? What do you feel when you have a common cold, right? You get stuffy nose. Your nose will get blocked, right? You can't take breath, and sometimes it can be nasal discharge. The Niagara Falls coming out of both the nostrils, right? Yeah. And you get a lot of sneezes, you get coughs, and you have body aches. Sometimes you have fever too, right? And who will get it? Everybody will get it, especially children are the most prone to get the virus. And why is it a problem? See, what is the problem with the common cold? See, it's a big discomfort. Yeah, discomfort to you. And the most important thing is you cannot go to school on those days. One thing, and it's a discomfort to your family as well, and it causes a lot of sleeplessness due to nasal block, and it can spread to others, right? And sometimes it can become a little bit uh, complicated, but okay. Now, how will you get it? How will you get the virus? So if somebody sneezes, like, hachi, they'll do, and they just, sneeze without putting their hands. They sneeze, and the virus will travel from your nose, from their body, to the other person. And if you are staying close by, like you're sitting beside your friend and suddenly he sneezes, then you get it, right? And somebody coughs, yeah, that's also thing. And suppose somebody sneezes like this, okay, he does that, and the virus will stick to his hand, and when you shake hands with them, and you also get it. And you use the kerchiefs or towels, or tiffin boxes as well, water bottles, then you'll get it. Okay, you share the things with your friends or family, they'll also get the possibility, right? Now, how to avoid it? See, most of the times, see, in this current situation, as you all know, there's a corona pandemic going. What is corona? It's a kind of respiratory virus, just like common cold virus, the same thing. Now we don't have treatment for that, but in the future it will also become very common, like a common cold also. Okay, so what are we supposed to do? See, first and foremost, in this pandemic situation and in the setting of the common cold, you're supposed to use N95 mask. What is an N95 mask? This is the N95 mask. Okay, it should be branded like this, and this is the best thing to avoid all kind of viruses and bacteria. It's called N95, and it filters all the, it filters 95% of the viruses also. Okay, suppose if this is not available, this mask is not available, what you're going to do? You use this surgical mask. Okay, this will protect around 60%. Suppose if you don't have any of this at your hand, use a cloth mask. Cloth mask. Suppose if it is also not available, just use your kerchief. When you sneeze or somebody sneezes, use your kerchief. That's it. Okay. And the most important thing is maintain 6 feet distance. Okay, maintain 6 feet distance with each and every person. As of now, it is very much important. And suppose what if somebody coughs or sneezes? Okay, if somebody coughs or sneezes, you just move away from that place for at least 15 minutes. Okay, the virus will fly away in the air, and it might not affect you. Okay, And even that is not possible. What are you going to do? Just somebody sneezes on this side, you turn your face like this and take a breath. Okay. Yeah, that's how it is. Now, um, and what, suppose if you get a sneeze, what are you going to do? The first thing is masks, surgical mask. You don't have anything, use the kerchief. And even that is not possible, see, use this shirt. Okay, use the shirt or the anything inside that, right? And suppose this is not possible, suddenly you get it, you can use this one. Instead of doing this, do like this, sneeze into your elbow, cough into your elbow, right? That would be better. And the moment you sneeze or cough, just wash your hands with soap for at least 20 minutes. Soap and water is better than sanitizer. If soap and water is not available, then you can go for the alcohol sanitizer. Okay. Now, what are we supposed not? I mean, what are we not? We're not supposed to do. What are the don'ts of the virus? See, don't go outside without a mask. Hmm? And don't sneeze or cough in public places. Okay. Don't touch your eyes. Suppose you sneeze like this, and you touch your eyes, you touch your nose, you touch your mouth, and that becomes another problem. And nowadays, and strictly avoid crowd gatherings. Suppose you go to function or any meeting or something, then you might get contracted with the common cold. And most importantly, don't share your glasses, your cups, or your water bottles with either with the family or friends. That can avoid the transmission. Now, suppose you got the common cold. Okay, see, despite of all these things you did, all the precautions you take, uh, suppose you get the common cold. Okay, what do you do? Okay, what do you do? Any other fine, I'll tell you. Okay, first foremost important thing is taking bed rest. You get common cold. First, take the bed rest. You completely lie down on the bed. It's always better to give the rest to the body to cope up, from the virus. Okay, and drink warm water. Drink warm water. See, it's not hot or it's not cold. Just like warm water. You can also drink soup. You can also drink tea. Okay, and you can also have fresh lime juice. And nowadays you find ORS anywhere. You can also have. And the most important thing is you have a nutritious food. Okay, don't eat junk food when when you're having fever. Okay, what are the common things you do? What are the common things you do when you get common cold? Simple as that. What Amma does, what your mother does, she puts on some Vicks. Okay, you can also apply some Jinda Tilsmat, and you have this eucalyptus capsules, right? That's called Carval Plus, and you can inhale. You can put them in the kerchief and you can inhale. Okay, what else do you do? The problem with the throat, right? And you gargle with the salt water, warm salt water. Gargle for 3 times: morning, afternoon, and in the night, right? And what are we supposed to do? Like, suppose if you're having a little bit of drying, irritating cough, then you have honey. Okay, honey is very much available in at your homes, right? So take honey, 5 ml thrice a day. You can also use corn syrup. Okay, and the most important thing is don't steam inhalate. Most of the people, they use steam inhalation. Actually, that is not recommended, and sometimes, especially in children, it can cause burns. So don't use a steam inhalation. It's called a cool mist inhalation with a vaporizer. Not steam. That's very, very important. And what you do, use nasal drops. Okay, nasal drop we get very frequently. It's very much available in the medical shop, and that is the only thing. See, we are not supposed to take any other medications from a medical shop. You have to go to a doctor, except for this normal saline drops. Okay, what does the normal saline drops do? They will open your noses. Okay, blocked noses. Okay, yeah. Now, what are the drugs? What are the drugs you're supposed to take? See, there are a lot of drugs. As you are, kids, you don't understand all those things. I request your mom, your parents, to take the kids to a doctor. See, initially, for 1 or 2 days, you just try for the home remedies. And suppose if the child is getting too much nasal block, and his ears are paining, or he's getting high fever, he's dehydrating, he's not, he has become very much weak, then you better take him to the doctor. Yeah, that is the best thing. And a lot of drugs are available, like expectorants, mucolytes. If the parents are hearing, I just want to tell you something, parents. Do not give antihistamines like cetirizine and all stuff, that kind of stuff, unless you know that it is absolutely necessary. Yeah. And there are a lot of drugs commonly used in children, like they put the nasal drops, like Otrivin and dextromethorphan syrups. We are not supposed to use all those things in children. See, adults is okay, but children, there are some specific medicines, and there are also specific doses. Okay, specific doses. It depends on the weight of a child to give a medicine. So for adults, it's very much common to give this standard dose, but not in the children. So it's always better to seek the guidance of a pediatrician himself, not any other doctor. A pediatrician knows what is best for the children. Okay. Now, as I told you, sorry for that. As I told you, then to see a doctor. You get a lot of stuff, difficulty breathing, you have a problem drinking milk, or difficulty swallowing, high grade fever, chest pain while taking breath. Okay, and it is very important. Like if you have ear pain, both the ear pains, in common cold, it's very common that you'll have ear pain. Okay, at that time you should see a doctor. And I rather suggest, don't self medicate. You see, apart from the things which I told you, that apart from using the warm water, soup, and Vicks, gargling with salt water, I sincerely suggest not to take all the medicines. Okay, and the most important thing is there is a thing called flu vaccine. It's not very much useful, but common cold, but it can prevent complications. Suppose if the common cold is going beyond 10 days and it is occurring frequently, then you need to take a flu shot. Anybody more than 6 months can till the life lasts, they can take this flu shot every yearly. Okay, and it's very much good, it can avoid a lot of complications. Okay, I request all the kids, you tell the parents to take a flu shot whenever possible it is, right? Okay, now what are see, the common cold, it is very common, as I told. It will stay for at least 10 days, 7 to 10 days, and it will fade away on its own, even without doing anything. Okay, so to avoid, see, some people, they don't eat food properly, and they eat a lot of junk. Okay, and they don't exercise, they don't run, they don't have physical activity, and those kind of children, those kind of children will have immunity less immunity. Now I'll tell you alphabets. Okay, alphabets, you can easily remember what to eat in a day. See, I have written this thing. So just ABCD, as you know, A for apple, simple. Okay, an apple a day, don't keep the doctor away, as they say. Okay, so apple a day. A for apple, B for banana, one in the morning, one in the night. Okay, and C for curd. Curd, 100 grams to 200 grams per day. You can add a little bit of sugar in it. I can also add a little bit of ghee. Okay, and whatever. C also comes with chicken. You can have the chicken 100 grams per alternate day. Okay, day by day, you can have the chicken, mutton, or the fish. Okay, and D for dry fruits. One fistful of dry fruits. Suppose you can hold this. You have to catch hold of the dry fruits. However, how much ever you get in your fist, you can have them daily. And E for egg. Okay, and it's one in the morning. The boiled eggs, not the fried omelette. It is the boiled egg, like it is along with the yellow. Okay, that is one in the morning and one in the night. Okay. F for fish, which is boneless. Don't eat the bony fish. Okay, it may get stuck and it will become a little bit problem. Can be messy. So always boneless fish we prefer. Okay, and G for ghee. Every gulp, whatever you take, which goes into your mouth when you eat, it should have ghee. It is very important. The ghee is very important because it will increase your brain capacity. It will increase your intelligence. Okay, and it will help your brain grow bigger. Very much important. And L for leafy vegetables. Okay, so most of the kids, they don't like leafy vegetables, and it's very actually I think it's very good because it contains iron. So if you eat you get iron into your body, your brain will definitely improve and your immunity will also improve. Okay, and there are very much supplements. Okay, vitamin A supplements, and which are supposed to be taken every 6 months till 6 years of age. Most of them, most of the doctors, they do not know, especially like general physicians and also, so they don't know. Only a pediatrician will know the right supplementation at the right time. We have to take vitamin A, and you have to take vitamin D levels. Okay, vitamin D drops. That is very much important. Till the age of 6 years, you're supposed to take, or else you need to have at least 1.5 liter of milk per day. Hmm? And you need to take the deworming drugs every 6 months. You need to get iron supplementations. It is very much important because till the age of 5, it's very important. Why? 95% of the brain develops by the age of 5 years. 95%. And that is why the nutrition till this age is very, very, very important. And half of the adult life height is decided by the age of 5 years. Suppose if you are 110 centimeters, at the age of 5 years, you'll most probably become 220 at the age of, when you become an adult. So the 5 years benchmark is very much important, and you need to take lot of nutritious food at this time, right? And parents, if you're listening, I would like you to take your children to the nearest pediatrician every month. Why? To get the height and weight get checked. Okay, that has to be matched with their age. Uh, and because some people may lag behind their age, it impairs their physical growth as well as their mental growth. Yeah, it's very, very important. And kids, and nowadays the biggest problem is mobiles. Avoid the mobile. Don't give the children mobile for more than 1 hour per day. That's it, including TV. Screen time, the total screen time should be only 1 hour, not more than that. It has become a biggest addiction. What are the problems with the screen? If you watch a lot of mobile, your eyes will become dry. Your frontal brain does not work. Execution brain doesn't work. You get ADHD, you get OCD, that kind of psychiatric problems are also coming, right? And little bit of, I know this is beyond the topic, but little bit of suggestions. And you're supposed to brush twice, once in the morning, and it is very important to brush in the night. Okay, and you should drink a lot of water, and toilet training is also very important for the kids. And one more last thing is, even before you get up and brush your teeth, I sincerely suggest you take some amount of milk or any liquid before brushing. Okay, see, the reason behind is some bacteria are in the gums. When people, when kids brush like hard, like this and this, so the bacteria may go into some heart, so there are some chances of getting some heart disease. It's always better to take the milk first and then brush the teeth. Okay, I hope I'm very much discreet. Actually the time doesn't